Well, good morning, everyone, and welcome to our Statewide Planning and Policy Council. And it looks as if we've got 85 participants. So really appreciate everybody taking time out of their day and be a part of this this group and going over several things that we've got to cover today. Just want to cover some housekeeping things. I know that I just want to say welcome to all of our guests that have joined today that may have not been a part of this in the past, as well as the presenters who have come on today to present some very vital information for us. And thank you all, as always, to our members for being so dedicated to this cause and the work that we do through the Planning and Policy Council. So what I'd like to do is just remind all of you to make sure your phones and computers are on mute as we go through. Like I said, we've got now 86 individuals that have joined. And so just want to remind you to do that. We also have the chat box feature as presentations and things are being covered throughout this meeting. Please utilize the chat box. And let's see, what we want to do is also remind everyone that pursuant to Tennessee Code 844-108, the Statewide and Regional Planning and Policy Council meetings will be open to the public and held through electronic means through conference call. The meeting is being recorded, and the recording will be posted to the department website and within the next few days after our meeting adjourns. Want to make a couple of announcements. Jan Cagle has been appointed as Vice Chair of Region 2, and this is upon the resignation of Amy Delinky, who has moved off somewhere else. And so we just want to welcome Jan back to the Statewide Planning and Policy Council. Jan's been a big part of, through the different regional, statewide, been very actively involved in the Planning and Policy Council. So again, welcome, Jan. If you have joined by phone, if you would, please make sure that you, just in case we've missed, if you will send Kirby an email letting her know that you were present, so we make sure that we have that on record. And Kirby's email is kirby.fi@pn.gov. And again, just let her know about your attendance. And as I said, just one more reminder, as the presentations are being covered, if you would utilize the chat box. And now, at this point, we want to turn to the minutes. As always, Amy Holland has done a great job with our minutes, and she has sent those out to this group. And then as we've gotten closer to today's meeting date, I think she has resubmitted those. And so these are the minutes from the February 9th, 2001 statewide meeting that was held. So at this time, we do, as Kirby said, we do have a quorum. And so I would like to see if there's anyone that would be able to make a motion to approve those minutes as written. If so, you could either do that in the chat box. If you would, go ahead and do that in the chat box. So thank you, Wayne King. Welcome, Senator Massey. I do believe that Senator Massey has recently joined us, so welcome. Very glad to have you. And
glad to be here.
Thank you. So we have the motion, and then Ricky Harris has seconded the motion to approve the minutes. All those in favor, say aye, or to And if anybody opposed, please send that through the chat box.
Aye.
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 All right, I believe.
Aye.
Okay. All right, I think we're good on the minutes. So at this point, has Commissioner Williams joined us
She
yet? Do you
has.
want to go into? Okay.
She has. Thank you.
All right, Commissioner, welcome and good morning. We are up now to hear from you of our update.
Good morning, everybody. Thank you so much, Kim, and another thank you to Senator Massey, and also if we have Representative Ramsey on here, another thank you to him and her. As I go over some of these comments, you're going to understand how very, very grateful we are for their leadership in the legislature. They have been instrumental in many of the funding items that we'll talk about today and other items that we'll talk about. Before I begin my comments, I just want to say, Kim, I can't see your face. I see that you're here and I see your circle. But Kim, you've been a fantastic chair for us during COVID and prior to COVID. We so have appreciated your leadership, your commitment, your dedication as you came and worked with us on our Sunset Committee, both for the Planning Council as well as for the department. And I'd like to say to you in front of all your peers how much we appreciate you, how much the council has done and grown based on your leadership. So thank you so much, Kim. The second thing I want to say is that we have a certificate from the governor's office of appreciation for what you have done during this time. And it's my understanding that's going to be shown right now on the web. There it is, Kim. Can you see your appreciation certificate?
I apologize, but I am having some major technical difficulties today. And all the others have gone just fine, and I'm having technical difficulties.
Awesome. Well, we are going to be mailing that to you as well as we can email it. If Kirby might want to take a shot of that and then just email it so Kim can see that.
I can do that.
Thank you, Kirby. Thank you. Again, we so appreciate you, Kim, and what you've done. The other thing I'd like to say is that we understand and are excited about my friend from Memphis, Tennessee, who I worked with while I was there starting out in my career, Albert Richardson. Albert, we're so delighted that the baton is being passed to you in this very important role. I know that you and Kim have had some time to talk about what's happening, getting up to date. So Albert, on behalf of the Planning and Policy Council, our department, we really want to thank you for taking on this role.
Well, thank you, Commissioner.
Absolutely. Absolutely. And then finally, is Ricky Harris on here? I'm not sure. I've been looking
I'm
to
here.
see. Awesome. Ricky. Thank you, Ricky Harris, for being willing to come on at this time to also serve in the role of vice chair. As many of you know, when we added substance abuse to our Planning and Policy Council, we wanted to make sure that we always had equal representation, both in chair and vice chair. So you'll notice that we have flip-flopped. The chair this year is a substance abuse and co-occurring representative. And then we've got Ricky, who's also primarily mental health and co-occurring. So again, we very much appreciate y'all's leadership. Ricky, do you have anything you might want to say?
To say thank you. It's an honor to be asked, and I am very excited about this year. I believe so much in the work of this council and have enjoyed it for all the years that I've been involved. So I'm very honored and excited.
Mm-hmm. Thank you so much, Ricky. Appreciate it. So now for the updates as I move forward, because they're pretty amazing. First off, many of you know that our research team has been looking at and tracking the impact of COVID on our state. I have been so proud every year to have a budget that we could show the gap between mental health individuals and substance abuse individuals that were in need of treatment and support services and prevention to show how close we were related to the population of mental health needs, and then how far we are related to substance abuse. I've been proud that we've been able to show a lot of movement in that area. However, with COVID hitting us, the research is showing increases in anxiety, depression, and substance use across the state. They're also showing that across the country. And I just want y'all to know that we're going to be redoing prevalence data based upon what comes in to be able to have new numbers to demonstrate what might be happening now in the state of Tennessee that will impact our overall numbers that we've been showing every year. But to that end, I want you to know that if it weren't for the providers that are on the call today, who continued to provide 24/7 access during the last year and almost 4 months, continued to provide outreach and treatment like our regional overdose prevention specialist, our Tennessee recovery navigators, we know that without our mental health providers and our substance use providers, the impact in this state would have been much worse than what it could have been. And I just want to say to you guys how much we appreciate you, how much your work and effort means in our communities across the state. To that end, I also want to talk about the new funding that has finally been awarded, has been signed off on, is coming our way that will really help each of you. The first amount is the $53 million new dollars that's coming in from the federal government to address post-COVID mental health and substance use needs. $53 million that will be over multiple years that we will be able to provide to our community mental health and substance use providers, as well as prevention, advocacy, and other providers. What we've decided, since this is one-time funding, as well as the supplemental block grant funding, which is also one-time funding, we are going to really look to our providers to tell us, here are the allowable activities. We want to know in your community what of these activities meet the biggest needs that you are seeing in collaboration with your local other provider networks and consumer networks and family member networks. What is it that you see that you think we need to fund more of? Again, it's one-time funding, it's not recurring. So as we talk to our SAMHSA reps and put in our document for approval, what we heard from the regional administrator is they thought our plan on this was was a good one because it's not a top-down approach. It really is, here's our data on what the needs are and the gaps are. We'd like you to come back for this one-time funding and tell us what you believe you can do with this one-time funding and do it in a way to impact as many Tennesseans in the most cost-effective, efficient, and quality way possible. So we finally do have the sign off on the mental health piece. Matt, I would ask you, we know that we were told by the national group that the substance use sign off is really slowed. Have we yet gotten the substance abuse, Matt or Taryn, to sign off on that?
I don't believe we have. There were some questions that they asked of the department, which we've responded to. But Taryn, if you could verify, I don't think we've received approval.
Yeah, that is correct. We have not received approval yet. We've had a lot of discussion about that over the last week, and it's our understanding that there's some slow up in the area of prevention, because prevention and treatment project officers have to sign off and approve, and that's where the slow up is. So we are still in a holding pattern until we hear back from them.
Yeah. And what we were told, guys, from the acting assistant secretary, is that this is really based upon a lack of staffing in the substance abuse side of the house of SAMHSA. They really, it sounds pretty unbelievable. They've got stacks and stacks of things that they've not been able to get to. So it's not that we're concerned we won't get it approved. It's just that it's taking them time to go through all of the things they need to go through with a really huge staffing problem at this point. The other thing that I wanted to talk about again, when you look at what Senator Massey and Representative Ramsey have done, is our new state funding, which is pretty amazing. We had talked some about what we thought we would get in our last Planning and Policy Council. So I'm excited to tell you what has been approved for sure. The Behavioral Health Safety Net for kids, $6.5 million going out across the state to our providers. The Creating Homes Initiative for individuals who are coming out of the criminal justice system, to really focus on that group of individuals with co-occurring substance use and mental health concerns. Statewide residential recovery courts, $4.6 million was allocated. That will allow us to stand up a residential recovery court in East Tennessee and West Tennessee, and possibly expand some of the recovery residential courts here in Middle Tennessee. The other part of funding that we are grateful to get is the Criminal Justice Liaison funding, $625,000. As y'all know, that funding allows us to have a criminal justice liaison in every county and helping with every jail across our state for individuals that are coming out, or hopefully keeping them from coming in, to connect them with the services in our community. We've got the mobile crisis services, $354,000. We were successful in getting ongoing recurring dollars for that very important service, and we're very grateful for that. The East Tennessee private inpatient, that now has become recurring. Again, grateful for that. We can show the need for that service in East Tennessee. So when you look at the overall community programming, that is what has come in this year, on top of almost $100 million worth of new federal funding that will go over multiple years. So at this point, I'd like to ask if Senator Massey would like to say anything, because you've been so instrumental, and also see if Representative Ramsey, if he is on here, if he would like to say anything.
Hello, how are you all doing today?
Hey.
And Commissioner, thanks for your kind remarks. You know, it's, we have, and she is the most respected commissioner there, and comes with the most passion of any commissioner that comes and speaks before and advocates for her department. So thank you for all that you do too. I just really want to thank all the providers. I mean, you all are at the front line, providing, you know, making a difference in people's lives every day. And it's our job as legislators, it's our job as the department to offer that support so you can have the tools that you need to be able to do the job. I know the staffing issue has been a critical issue that we've had discussions that we had hearings on it in the health committee. And, you know, I mean, of course, that is in a lot of arenas, but we're going to have to get a grip on that to be able to provide the services, because if you just have the dollars, but you don't have the people that can work at the front lines, it doesn't do us any good. So just know that I believe in what you're all doing. You're making a difference, and thank you. And if I was in person, I'd be patting each of you on the back. So have a great day.
Thank you so much, Senator. We also know that you have amazing passion and commitment, and are very articulate about the needs, the concerns that we all address every day. So appreciate you and your spirit very, very much.
You're welcome.
I would like to see is Representative Ramsey on here with us. Okay, so I will go on now. Now, Senator, I want you to know I'm going to be talking about the workforce development and what our plans are in just a minute. So I hope you'll be able to stay on for that as a result of the committee hearing that you guys had. And as you know, you had TennCare and us at the same table. I'm very excited to tell you what TennCare and our department's going to be hosting next week. So I think you'll be excited about that. Yeah. The next piece is a certified young adult CPRS program. I wanted you to know that we are moving forward with that program. As many of you know, if you can intervene in a youth and their life and help with screening. I know that MHA has been doing so much. I read that report, Ben and Tom, about screening and suicide. We've got a meeting that I've asked to be set up to talk to y'all. That report's amazing. But we really do know the younger that we can intervene and help people both learn what's going on in their life, as well as how to have coping skills and how to respond to that, we will so impact the future. So I couldn't be more excited today about our CPRS program. And I'd like to ask Matt, are you or Lisa Reagan or is Jules on here that might want to say something about that program before I move on?
Hey, Commissioner, I'm not sure if Lisa's with us or not, but what I would say as far as the youth and young adult certified peer recovery specialist program, this is a big deal for the state. I think we have a long, rich history in engaging adults with lived experience and bringing them into the workforce. This is a unique opportunity for us to engage young adults to become peers, to work, within the community provider network. So not many states have taken their peer program this far, and we're fortunate to have the ability to do it through this new curriculum. So Lisa, are you on the call, or Jules, anyone else?
I'm here. Good morning, everybody.
Good morning.
Yes, I am so excited this is going to happen. I think it will be truly instrumental in many people's lives to have this young adult peer support specialist certification. Folks have been asking about it. Where is it? When is it going to happen? So it's wonderful to say it's going to be here. I think you guys know I believe so much in peer support. It's what keeps me going every day. So I'm real happy we're doing this.
Thank you so much. Is Jules on here?
Commissioner, this is Carrie Virgo. No, she is not.
Okay.
However, I just want to say we are incredibly excited. We are looking to set up trainings and get things moving expediently. So we are so grateful for everybody who's been a part of making this happen. So thank you all very much.
Absolutely. Thank you, Carrie. I didn't know if you were on here, so I'm glad. Thank you. Appreciate you saying something on that. The next piece I want to talk about that we're very excited about is our media campaign. Is Matthew Perriott on here? Matthew's our Director of Communications.
Hey, Commissioner.
Hey there, sir. Again, I've always said you're the best director anybody could have of communications. We are running a couple of media campaigns that Matthew has been really the spearhead for that. One is about the Children's Behavioral Health Safety Net. I would love it if we could send that video out to everybody. Matthew, if you could work with Kirby on that. Obviously, what we're wanting to do there is to get more people to understand there are services available for kids that are uninsured. We really want individuals to understand we can serve you through our community behavioral health network, and then obviously move that person into TennCare if they are so eligible for that. Very important. The next piece that we're doing media on is the crisis services campaign to make sure as things are increasing across our state in anxiety, depression, substance use, people know the numbers to call. I did see Mary Linden. Mary Linden, I know that you've experienced a higher call volume. And I know that Matt has been talking some to you about that, and Taryn, and I'm hoping that we can help with that with some of the new dollars that we've got. Matthew, do you want to add anything to this piece?
I'll just share, we're statewide on social media with these ads. And something that I've really noticed this time around that I didn't notice, 2 years ago when we did the crisis campaign the first time, 3 years ago when we were doing the Tennessee Together campaign, is on social media, people are liking and favoriting and sharing the ads. I mean, you think about your own personal social media usage. When was the last time you shared an ad right? Usually you hide them, you run away from them. People are sharing the content, they're interacting with it. And I think that really speaks to the hunger for, the amazing services that you all provide and just how receptive people are to what we're all trying to get across. So really, really excited about that, and just proud to put it out there.
Thank you, Matthew. We're proud of what you're doing for sure in that regard. Before I move on to the workforce work group, I want to also touch on something that we had talked about. I believe it was in December, but there was a presentation. It might have been another month last year, but there was a presentation regarding ADA, in particular the deaf community, and services to that population across our state. Our department took to heart very much what we heard in that presentation and have had, and I don't know if Lisa Prim's on here, but have had discussions with Lisa and with DRT. And one of the things that I'm proud to announce is we're going to expand our ADA workforce in our office. So right now, when our department's working on contracts, scopes related to ADA and being able to be accessible to all individuals across our state in all of your contracts that are providers. We've had our legal office that's been there. We've had our human resources office as well as our contract staff office. But we have come up with a plan and got approval to move forward to start interviewing for an ADA coordinator. And so I'll be very excited in our next Planning and Policy Council to introduce you guys to that person. That person is really going to focus on the community and what we're doing across the community and with our providers to make sure that we have accessible services in the best way we can. When we reviewed that, we do believe that the provider network is meeting the minimum standards, but we're hoping to expand that, and very, very excited about that. The other thing is we'll have a council, an advisory council that will include individuals that are part of that community. We'll be talking with Kurt to see if maybe we might want that to be a part of our Planning and Policy Council. Haven't come up with a final decision on that. As you guys know, we're trying to coordinate and streamline things so that everybody is using their time in the most wise way possible, because we don't have a lot of extra time. But again, I wanted to make sure that you are aware of that, and look forward to picking the best individual to represent us in that regard. So the last thing I wanted, yes, did somebody ask a question?
Hi, Commissioner. Sorry, I'm taking this back. I just missed it in the chat. Elliot Pinsley actually had a question about adult CPRS.
Okay.
And the question is, will young adult CPRS professionals be grandfathered in to get a standard CPRS credential when they reach a certain age?
Lisa, can you respond to that, please?
I sure can. The Certified Young Adult Peer Support Specialist certification is truly unique and really focuses on the unique needs of young adults. The training itself overlaps with the CPRS training only about 20%. So because of that, the young adults will need to take the CPRS training when they're ready to move in that direction. And it's free. We'll make sure they get trained.
Thank you, Lisa. Elliot, does that answer your question fully?
It does, yes. Thank you very much.
Good, thank you. Thank you. All right, so the last thing that I want to talk about that Senator Massey touched on, I don't know if she's still on here, is our workforce work group. As you guys know, this is something that we've been talking about for some months and over a couple of years. However, in this past year, it's the first time that we had a number of providers tell us we don't have people that we can hire with the funds you've given us. And that was like, wow. If you look at the data, the research around vacancies related to any job, I was just reading that they don't have enough airline pilots to fly planes. We don't have enough hospitality workers to work in restaurants. We don't have enough doctors to do healthcare. Well, it's finally really hitting the social work, social service, counseling part of what we do. And it's something that we are very excited about, that in talking with TennCare, talking with Stephen Smith, that he said, hey, I'd like to co-facilitate this with you. And so we will be doing this workforce work group, behavioral health workforce work group, that's really focused on the public system. I can't say enough about the work that Matt Yancey has put in working with TennCare to put together a really wonderful and very targeted program that we will go through to talk with multiple providers, multiple college, multiple university, multiple TennCare, as well as our Planning and Policy Council reps. We're very grateful that they will also be on this workforce work group. And we've got 3 goals in mind, and we're also going to try to get it finished so that if there's funding that we might want to ask for, that we can get it in this year's budget. So that's a mighty big task, but I really do believe how Matt and Mary Shelton have looked at this, as well as myself and Steve, and I think we can accomplish that. So we've got 3 goals. One is to clearly identify gaps and needs related to the public behavioral health workforce in the state of Tennessee, using data specific to our state. And we're looking at current data, today's data specific to our state. Assess for strategies to address identified gaps, including proven actions to support the effective recruitment and retention of public behavioral health professionals in the state of Tennessee. And then finally, develop a report for key decision makers, which will highlight identified gaps, but more importantly, will offer Tennessee-specific effective strategies to address the public behavioral health workforce challenges that we face. Our first meeting is this Tuesday. I've spoken to a couple of you that really have had a background in this area, and we so appreciate your interest based upon how we were looking at statewide entities to interact. There are a couple of people that were not able to be a part of the work group workforce, but that does not mean that we are not going to listen to what you got to say. To that end, we know that Kim and Albert will be there to speak on behalf of anything you want to add, as well as Matt and I would love to see anything that you want to make sure that we take into consideration. So for any member on the Planning and Policy Council that wants to make sure that we hear your voice about this issue, I'll explain that we've got Ellen Wilbur from TAMHO. So if you're a mental health provider, I really think it'd be great to get her information. Mary Linden on the substance use side, our Planning and Policy Council individuals. And then Matt, can you tell me who else? Do we also have NAMI? I can't remember if NAMI's a part of this. So the statewide NAMI group, Jeff Layden. All right, so again, just want to make sure everybody's very aware this is something we take seriously, and are very hopeful that we can come out with some really specific recommendations that can impact our state in this regard. So that concludes my talking points and discussion, and I'm open for any questions, comments anybody has for our team.
Commissioner Williams?
Yes.
First of all, great report. There's a lot happening. To figure out how to use this new money properly, you got to be Solomon, and I have confidence in your team to do a good job with that. However, I think there's some unmet needs, and I have an eye to the future. For example, you talked about the Creative Homes Initiative and coming from jail, which is very exciting. And I'm thinking about just one little idea here, that if we had a certified peer support or like a family support specialist for caregivers of adults that work, adult to adult that have adult children. But given that as an aside, that's an example. How do we position ourselves? What are you seeing for what we expect from Washington for new dollars related to caregivers, to prevention, to crisis, to law enforcement? That we keep hearing, more is expected, but once a grant comes out, you got a little window, and then you have to have your MOUs and your plans and everything right away. So what can we be doing to sort of, what do you anticipate that might be coming, not necessarily just through your department, but also from SAMHSA or other folks interested in, there's so much concern about mental health and addiction and how this is
Yes,
impacting everybody with the pandemic.
right. Jeff, that's a great question. We know that we've gotten information about President Biden's proposed budget, and that would probably be helpful. I don't know, Kirby or Avis, if we have sent that out to the planning and policy members. That is what we're expecting, Jeff, if it gets approved. So that would be helpful if we could send that out to the planning and policy council members so you can see the monies that are earmarked and the timeframes that they're earmarked for, Jeff. We know from our discussions that crisis services are very high on the list. Again, I want to make sure people are clear. Our state actually has the full gambit of crisis services that other states don't have. So when we participate on these calls, we're listening to people that say, hey, I'm just trying to get one CSU up, or hey, I'm just trying to get a mobile team to go, or hey,
Yeah.
I don't yet. Ben understands. He's been listening. I mean, it's like, and we're sitting here going, hey, we're just trying to fund all these things we have at the level that keeps it going. So there's so many differing vantage points, Jeff, about what the feds are looking for and what each state has, which again is why I think our decision, when you said Solomon, I think it was a wise decision to say, we're going to allocate the funds that are one time to our local providers. We're going to say, here's what's allowable to apply for with the emphasis that SAMHSA's putting on different activities, and allow you to say, which of these things do you want to meet? Because when SAMHSA talks to us, they're like, y'all got the whole kit and caboodle. We're going to have to increase funding with that, which we have done over the last year. But when you look at our service array with crisis services, we've got that. When you look at prevention, Jeff, which is so important, that's why the stuff that I saw with Ben and Tom, what they sent in with MHA, I really am excited about this conversation. What I saw is it looks like, Ben, that our state has done more screenings than any other state.
No, I don't think that's exactly correct, but I think what is correct to assume from that report is that our number of screeners expressing suicidality is not as high as other states, and that's really positive.
Yeah. When we talked, there was a column, Ben, that showed number of assessments, and when I looked at it by state, it looked like, again, we'll look and see, it looked like we had a higher number.
Yeah.
But Jeff, the other thing that you've alluded to, which is working with peers, doing prevention, one thing that we try to do our best in our department is there's not an unlimited amount of funding, right? So what we try to do is look at the gaps and the needs based upon the number of individuals that are struggling with severe mental illness and also struggling with substance use and addiction, right? And so we look at that by county, we look at that by region, and really try to attempt to fund those services that will have the biggest impact. That means some services we don't get to fund. And it's a hard place to be in, because you've got wonderful choices, and then you got to decide and prioritize which of these choices really impact and have an outcome on this other end with the limited dollars that we've got. I hope that helps answer your question, but we'll get you the SAMHSA budget that's been requested that really does go over what the president's looking at. It also is in the criminal justice budget. He's focused on behavioral health, labor. He's focused on behavioral health. So we'll make sure that we can get that budget out to you as a member so you can see that. That's a great question.
I appreciate that, and I bring it up in part so that we're not always knocking on your door to fund
Right.
everything, because if there's other resources that we can bring into Tennessee that come from the federal government, I'd like to help to do that.
Right, right. Absolutely, Jeff. Thank you.
Commissioner, could I ask you a question?
Yes, sir.
First of all, thank you very much for clarifying the intent or direction for the work group. It's greatly appreciated. I also wanted to thank you for spelling out some of the initial goals of that group. But I did want to weigh in just briefly, if I could. Other states have started to address this too, and one of the things that other states have been concerned about is looking with a lens past the immediate needs of the service delivery system in terms of how many vacancies do we have and stuff like that, but really project a little bit further out how many licensed professionals are we going to need in the public sector in 5 years or 10 years or 15 years. And I wish you could weigh in on that too, because we obviously have to have a broad lens as we work forward to try to address this issue.
Ben, I really appreciate that. One of the slides that we have, I believe, is based on HRSA data about a projected need, but I want to make sure everybody is listening very clearly to this. Those were based on pre-COVID estimates.
Yeah.
There's no COVID projection and impact. So like what we're going to do is do our best with the information we've got, which is what you're saying. What is the projection? Because this can't be short term. We're looking at how many graduates over the last 4 years are coming out of schools of social work, schools of counseling, schools of addiction. How many are coming out? Has it been declining in our state? Because again, this is our state. We're not doing it for any other state. It's our state. Is it declining? Is it going up? That'd be really helpful, wouldn't it, if we saw that it's going up? But what you're saying, Ben, is absolutely true. We're going to look at what do we need now and what do we think we'll need in the future, with a caveat that says this is based on past data. We don't have the COVID impact data.
Right.
And I don't think we're going to have that, Ben, for a while, but your point is well taken. Matt, do you want to add anything to that?
I would just add that in our conversations with TennCare, who will be co-facilitating the work group with us, I think one of the things, and we agree that we want to accomplish, is identifying both short-term immediate strategies and long-term strategies that speak to some of the things that you raised, Ben. So my hope is that coming out of this work group, we'll have ideas that can be put into motion almost immediately, and then things for all of us to think about collaboratively future forward. So just wanted to say that's going to be the design of how the strategies are presented, both short, immediate ideas versus things that we need to think about for the future.
Great. And I have one more follow-up, if I could. Are there plans to circle back to the planning councils and share some of the work product and help us understand where this is headed? And I ask that because I think the needs assessment committee saw, or the planning and budget committee saw, 7 out of 7 regions said workforce is a key issue. And at least one of the subcommittees of the council said the same thing. So tell us what your plans are to circle back to keep us in the loop.
Absolutely. Our plans are to keep you absolutely updated, both the executive committee and then the full planning and policy council. I did take a look, as I said in our last meeting, Ben, I needed to see what the planning and policy council was saying. I saw that that came in from the regions. So our whole thing will be to come back to y'all and say, hey, this is the draft, this is where we're at. And then when we do the final, this is the final. Remembering that we're trying to get this accomplished by the time I have to submit a new budget for the governor and the legislature. So am hopeful that we can get that done pretty quickly. Ben, you've already sent us some really good source material, and we appreciate that, and have been looking at that as well. So yeah, we will for sure circle back with you guys.
Awesome. Thank you so much.
Absolutely. Thank you. I saw many providers and individuals shaking their head that this was needed. Candace Allen, Debbie Hillen, Daryl Murray. Let me see who else I'm seeing out here. Ellen Wilbur, who will be a part of that. Anyway, very, very grateful for all of you that will be participating in this, because we know it's something that we need to figure out the best way, and obviously in tandem with TennCare that funds a huge part of our system. So I'm glad they're going to be a part of that. Is anybody from TennCare on our Planning and Policy Council today that might want to say a few words about the workforce group?
Commissioner, this is Robin from Region 4.
Thanks, Robin.
Yeah, I really want to, I want to thank the efforts of, first of all, thank you very much for convening what you're doing. And Matt, thank you so much. And I want to appreciate the efforts of the planning councils, particularly Elliot Pensley and Ben Harrington and the others of you who, you know, brought this up as an issue, because it is something we've seen coming over the years. Even prior to the pandemic, we were kind of faced with that. I know locally here in Region 4, we saw MTMHI struggling to be competitive in the workforce. It's been very, very difficult for them to be competitive locally in the workforce. And then we've had the shortage. So I just wanted to praise that and praise this effort. Thank you so much.
Robin, thank you so much. Really appreciate that. And absolutely, we know that Elliot worked with TAMHO on a report that is something that actually was being discussed in the legislative committee hearing. So there has been past efforts to look at this issue. And like I said, I'm just glad, you know, many times people wait until they get mandated to do something. We didn't wait for the legislature to tell us they wanted us to do this. We took it upon ourselves to do it. And again, am grateful for the people that will be at the table that represent statewide agencies that have employed a lot of people. I've talked to many providers that are just struggling right now, and we're very hopeful that we can come up with real actionable items, not just some philosophical paper, but here's what we want to do in this state. And having TennCare be a part of that, as y'all know, really will put us in a great space to move that forward. Are there any other questions or comments about anything that we've gone over today?
I have a question.
Yes.
Hi, I'm Rebecca Lewis. I'm the young adult representative.
Hey, Rebecca.
Hi. So I was wondering, I've been thinking about your early engagement question, which was, what do you see as a need for the community? And I was wondering, as representatives of specific demographics, how do we increase our information and outreach so that we can better support providers here on these kind of planning policy committees and other ways? Do you have any wisdom for building that open curiosity necessary for good information and research building?
Okay, so Rebecca, I really like the statement open curiosity. That's something I'm going to need to remember, because that's a great way to live. But I'm missing what you're wanting to have that connection around. So when you say demographics, are you talking about youth? So having the engagement with youth, can you say a little bit more about that?
Yes. So my demographic, the one that I'm a representative of, would be the youth and young adults.
Got
There
it.
are other people here that represent other different demographics or areas
Right.
instead of
Right.
different policy programs.
Right.
So when I'm speaking of demographics, I'm speaking to the engagement of specific groups of people, learning how to engage with the system in a way that can help meet the needs of those communities.
Got it. Got it. Well, I can tell you, and I really appreciate that. Do you know Lisa Reagan? And do you know Ellen Wilbur and Mary Linden and Jeff Blade? Do you know these people in our groups that actually work with the communities and the providers? Because I would really suggest that you start with Lisa Reagan. Do you know her? Have you
I
talked to
think
Lisa?
we have been on a couple of meetings together, but I haven't interacted all that much directly.
Here's what I'd love. Lisa, if you're still on here with us, if you will send Rebecca your contact information, Rebecca, she'd be the best person to begin with and talk about the ideas that you've got. I will tell you, if Matthew Perry is still on here, we are hiring a youth to do an internship with us about this very issue related to social media, because we want to do more in connecting youth and young adults. And then, of course, the programs that we run for youth and young adults under Carrie Virgo. I know Carrie's on here. I would love it, Carrie, if you would also connect her with your contact information. That way you can see what's happening with the department. And then, like Ellen Wilbur, who's on here, who represents the Tennessee Association of Mental Health Organizations, at that point, we can get you the names of individuals that are over those organizations that you could do some outreach with and brainstorm and keep an open curiosity. I love that. Ellen, do you have anything, or if Mary Linden or Jeff Layden or anybody else that's representing statewide organizations would like to say anything to Rebecca?
Rebecca, I just want to say hello. It's Ellen Wilbur, and I did put my email in the chat box, so feel free to reach out. We'd be happy to connect you with providers, mental health providers across the state. So thank you for your interest.
Thank you so much. I really
Absolutely.
appreciate the
Thank
chance
you
to
for
ask questions.
asking. Thank you, Rebecca. Thank you for asking. All right, it looks like everybody else is putting their information in the chat box as well. Any other comments or questions? All right, hearing none, I just want to end with a very important couple of important words. Number one, our team has worked so hard, y'all. We've met the deadlines on over 1,000 contracts to get them processed so y'all can get money to do the services. They have spent tireless hours going back and forth with the new funding that we've gotten. And I just would like it if you would join me in giving a huge round of applause to our team that's on here. They're amazing. And I just am so proud of our team. So I will end with that and hand it back over to you, Kim.
Commissioner, before you do that, this is Debbie. What?
Hey,
No
Debbie.
song?
Debbie.
No song today?
Debbie, I'll tell you what's happened today. My speaker is, I can't get it charged up. I would be doing a song today, but my speaker truly, it's not charged up. And
All right. I was expecting a song.
We'll do it the next time, Debbie. Thank y'all. I'm going to stay on to hear the reports. Really excited to be here today. Thank you.
Kim?
Yes, this is me.
Okay. We can go on to the reports. Hold, please. Kim, you're muted. She just sent me a text. I'm not sure. Well, in order to stay on schedule, we can go ahead to the regional council and statewide committee reports, and we'll start with Region 1.
Good morning. Can you hear me?
We can.
All right, thank you. This is Tim Perry. I'm the chair of Region 1, Northeast Tennessee. And our report is Region 1 Planning and Policy Council met virtually means on May 11th with 27 in attendance. There were updates on the continued process for membership enrollment, which is going well. The CNY subcommittee reported on the Regional Kid Power Day that would occur on May the 29th at the Johnson City Farmers Market. There will be 20 vendors focusing on mental health well-being of children and families following the COVID pandemic. Local inpatient hospitals reported that the ED visits in the Northeast region for behavioral health issues seemed unprecedented over the last couple of months. Patients are having longer waits in EDs for placement in hospitals as a result. The legislative subcommittee reported that they are working to redevelop this subcommittee in Region 1 and to make it stronger by enlisting 7 members to become part of the committee over the next several months. Tennessee Commission on Children and Youth reported on their continued Building Strong Brains series trainings, an upcoming training on human trafficking, and planning a near future training on the lasting behavioral health impact on children and families of the COVID pandemic. TMHCA reported on the gradual and systematic reopening of some of their peer centers. Frontier Health reported on the expansion of school-based services to all 14 school systems in the area and the new opportunities for behavioral health safety net for kids who have commercial and private insurance that does not cover certain behavioral health services, and a new partnership with Ballad Health to expand free nurturing parenting classes to the entire 8 counties of the Northeast Tennessee area. And then Kirby was there and gave a report on the department and an update. Our next scheduled meeting is scheduled for August the 3rd.
Great. Thank you so much, Tim. And I apologize. They updated my computer yesterday, but it has really messed it up. So thank you for unmuting me since I was unable to do that. Let's move on to Region 2.
Hi, my name is Mary Nell Osborne, and I'm reporting for Region 2. I'm the chairperson, but by no means the most important. I want to thank everyone in the state again for their support, and I want to give a shout out and the gratitude from Region 2 for the support of the department, in particular for legislative and financial support during the COVID year. As we know, the challenges aren't over, and we go back to in-person sessions. We continue to learn about the impact on the pandemic on our behaviors and on the impact in our community. So thank you, Commissioner. One of the terms that I heard that we're all struggling with in our own private lives and our professional lives is we're moving at the speed of trust. As we feel comfortable, as others feel comfortable, as vaccinations are increasing among the population, it's that comfort level established by trust. So all of us are doing that. Thank you, Commissioner and Department. In Region 2, we've remained hard at work, and we have submitted 4 needs assessment, 2 for adults and 2 for children. Identified needs in the community, some of which you've been reviewing. I won't go through those, I don't think. If I need to, I will. Our last meeting was May, and we will be meeting again in August. And not sure how that's going to happen yet. It may be a hybrid mix. I would like to think that we can continue to offer virtual opportunities for folks. Our legislative committee has also been hard at work. And I know that there was a report from that committee that I have not been, I was off yesterday, so I've not reviewed it. But I do know that the challenges we continue to look at are the lack of affordable housing in rural and urban settings, specifically for mentally ill adults, a lack of access to technology in rural communities still it seems to be a challenge. I work in Sevier County and know that that is a reality still for our folks back in the hollers. And a lack of crisis units for children, lack of inpatient treatment beds for children, and residential facilities for levels 2 and 3 adolescents is challenging right now. We've continued to talk about what might be solutions for those. The lack of mental health services, including medication in jails, is a great concern. Transitioning out of jail back into mental health community, mental health is a challenge as well. And then again, the shortage of mental health staff is a huge challenge. So all of us working together, surely we can come up with some good solutions. Ben, did you want to speak to the legislative committee findings or anyone else on that committee?
Ben had to sign off.
Ben had to sign off. Kirby?
Yeah.
I don't know. Our next meeting is going to be August 11th. I did get to that. And again, our thanks for the support and involvement of the department staff, but also for the committee members who have been working very hard in these days. So that's all I have to report.
Mary Nell, this is Marie. I just want to say to you, thank you for your kind words, and also thank you for the comment, speed of trust. One thing that we know has gotten us where we're at today in the field of mental health and substance abuse in this state is the trust that we have had between our provider community, our consumer community, our family community, everyone. And I so have appreciated that because, as I've said in the past, when you look at our issues, it's very easy to say we're a minority group in a majority of Tennesseans, right? Related to the numbers and all of that. And so what I've so appreciated is that we work together. When you listen to other commissioners in other states, they'll talk about horrible infighting between different associations, even their planning and policy council, which I've never I mean, how can you have infighting with your policy and planning council? And so I so appreciate this group and that ability for us to talk about where we see the gaps, but also to recognize where we're moving forward. So Mary Nell, a lot of the things you talked about are already in our budget, right? That they're getting funded in the budget. One thing I didn't speak to that you did bring up was the issue around children in the emergency departments. And we're actually working with TennCare again and a work group with the judges to talk through some issues with that. So thank you for your words. Thank you for the speed of trust. And I, again, appreciate that.
Feel free to use that. A good one.
Open, I'm going to use that in open curiosity. I'm learning a lot today. I mean, I like both of those things.
Yeah. Thank you.
Thank you, Mary Nell. Appreciate it very much. Let's move on to Region 3.
Hi, it's Gail Lodato. I'm the Vice Chair of Region 3. Our chair is going to be delivering her second baby today, so I'm stepping in for her. So we'll wish Deanna well. We met on April 15th and had 27 participants at our meeting, and it was a virtual meeting. We reviewed the final needs assessments and a couple things, again, complimentary to the department. Two of the concerns that were identified by our adult committee were the continuation of telehealth services. We feel we've been able to reach some individuals who we wouldn't otherwise have been able to reach. And I know that that's already moving forward, as well as being able to increase behavioral health treatment and recovery practitioners in our community. And we continue to hear that that's being addressed at a state level. So we're very appreciative of that support. Our Children and Youth Committee identified 2 areas. One is aftercare for children and youth who have adolescents primarily, who have completed a substance abuse inpatient treatment program. We're finding in our region some limited aftercare and support groups for them to maintain their sobriety. And in addition, we are continuing to assess the need for respite care for children and youth in our community. We had a resignation of our Region 3 secretary from Rhonda Moore. We are extremely grateful to all that she did to support us over the past couple of years. We had a nomination of Danielle Beck, who works for Health Connect America. I believe at our next meeting, Kirby, you can correct me, I think we'll have to officially vote. Oh, no, I think we did that through email. We have voted for her to be our new secretary. So we are excited to have her join us. And we're continuing to focus on increasing our service recipients, their family members, and other members of our community to have their voice be heard in our region so that we're accurately identifying the needs in this region and sharing that with the commissioner. Our next meeting is on July 15th. And that concludes my report.
Thank you so much, Gail. Let's move on to Region 4.
Thank you very much. This is Robin Nobling of Nami-Davidson County, Chair of Region 4. And Region 4 met on May 5th. We had 23 people in attendance. I really want to thank the department staff, Avis and Kirby and Kurt, for always, not just this time, but for always being supportive in our efforts, especially through the pandemic. You know, I know Kirby has learned more about WebEx than she ever thought possible. And Avis has been right there. So I want to thank you for that. And Kurt came out and shared with us, you know, what was going on in legislative session, also gave some feedback as we were asking, you know, things related to the needs assessment. For us, this meeting was a review of the needs assessment that had been submitted. And I really do want to thank our Vice Chair, Angie Thompson, our Legislative Chair, Elliot Pinsley, the adult chairs, co-chairs, Shara Biggs and Evelyn Yergin for their input into that, and the whole council. We do have a consensus format that starts in November that feeds into our needs assessment. Things that we were looking at that we were concerned about in Region 4 included the depletion of substance abuse funding for treatment, sometimes before some of the providers' year-end came. So that was, and sometimes foundations take over, but they're not always there to do that. So that was an issue that was brought up. Workforce is something that we talked about. As you heard, a lot of the councils were addressing that. Access to urgent outpatient appointments. If we can't get same day, then how quickly can we get them? And there were some good thoughts on that for addressing that, but I'm glad it was brought up. Housing for seniors with complex needs was something that we were looking at, especially in Region 4, and you may see this in other populated areas where the housing boom is just, in some cases, just the group homes and other places are just, it's more profitable to just sell the building. And so this is really an issue for us in losing housing here in Region 4. With another issue we were talking about was follow-up and outreach for first outpatient appointments after hospitalization. And one of the stats that we had from one of our providers that was 50% of the people are not following up, and looking at ways that we could facilitate that and how providers might facilitate that, and how MCOs might facilitate that. And it's nothing new. It's been done, but this is something that that we were concerned about for aftercare and recovery, because that's the whole point, is to get people into a good place of recovery, not just until they have their next hospitalization. So those were some big things that we were doing. The legislative committee had met and reported. We had both Elliot and Kurt reported on Elliot on proposals we were looking at, and then Kurt on the legislative session, what was happening there. And Elliot also helped with that. I am stepping down as chair of Region 4, all for good reasons. Our agency, NAMI-Davidson County, is growing. And I have been serving in my 9 years with NAMI-Davidson County. I actually started as a chair on the Children's Council the first day on the job. So I have been in leadership the entire time I have been here. Our council decided that they nominated Shara Biggs, and she has accepted, to be the Region 4 Council Chair. We have not completely done the process, the voting process to complete that, but that is something that we are in the process of doing, and we will do a nice transition so that Shara feels supported what she's doing. I am not going anywhere. I look forward to continuing to serve the council and support its efforts. Our next meeting is going to be August 4th. And we have not yet decided, as I'm sure some of you are still in the decision-making process, whether that will be in person or something that we do by Zoom, but we will accommodate that according to CDC, according to the governor, and according to the wishes of the council members. Thank you.
Robin, thank you so much. And sad to see that you're stepping down, but as I know you, I'm sure that you will continue to be a very, very active participant in Region 4 and the statewide. So thank you so much for all that you have done, and looking forward to working with the new chair stepping up, Shara. And so thank you again. Let's move to Region 5.
Good morning, everyone. This is Debbie Hillen with Region 5. We met on May 6th, and we still did it electronically for our meeting. We reviewed our needs assessments that we turned in, establishing a CSU in Region 5, and to provide youth mental health first aid to school staff. Those were the two mental health assessments. From the substance abuse, it was to increase the medically monitored withdrawal monitoring program to help fund detox for the indigent clients, and to increase funding for the MAT, especially as it relates to regulations that are being put on providers, such as substance abuse providers, with the DEA and certain costs. We had a program. I'll tell you, our program was on Project Rural Recovery. And I'm not going to go through my notes as far as that relates, because you're going to hear about it in a few minutes. So I'll just say that was our Darren Lehman joined me as we did that presentation. We also discussed any ideas for legislative proposals. After that, Kirby gave the updates for the state, and we had Kimberly Ladd, who graciously agreed to chair the Children's Committee, and we wanted to celebrate her big time. And at the same time, Sherry Allen, who has been serving as secretary for Region 5, left Buffalo Valley, and she took another position. And so our secretary position, like somebody else just mentioned, is open, and we'll be looking for a secretary for the next meeting. Our next meeting, like everybody else, don't know whether it be in person or electronically, is August the 5th.
Thank you, Debbie. Region 6.
Good morning, everybody. Richard Barber, Chair of Region 6. good to see y'all's little faces on them little squares. Region 6 met April the 13th via WebEx. And like Robin said from Region 4, I just want to co-sign what she said. You know, the pandemic has created challenges for all of us. The staff at the Planning and Policy Council has helped us meet those challenges, and we've been able to go forward. So we appreciate you. Kirby presented the department report, and most of our meeting revolved around a needs assessment as it was due just a few days after that. And we did settle on our needs and decided to forward to we accepted and forward to the state. And they were in mental health. It was the mental health curriculum for schools and the peer-to-peer programs. And for substance abuse, it was post-treatment case management for substance misuse. And of course, as the commissioner talked about a little earlier, we wanted to focus on some workforce development issues here we have in Region 6. There was a program, Handle with Care, that TCCY presented. We had some agency reports and then scheduled our next meeting for July 13th. Hopefully in person, I guess we'll see. We'll just go with that trust thing we've been talking about. Thanks, y'all.
Thank you, Richard. Moving on to Region 7.
Good morning, everyone. My name is Bartholomew Allen. I'm the chair of Region 7. Region 7 met on Tuesday, April 27th. We met via WebEx. We had a welcome introduction and approval of the minutes. Kirby gave the updates from the state. And after that, we had a very healthy discussion of the assessments and the needs that we submitted for this term. A lot of discussion on how we want to move forward with our needs. A lot of discussion about networking and doing some politics on how to get our needs pushed to higher levels, outreach, communication. Really, really great discussions. So really great people participating in the discussion as well. We also talked about enhancing and establishing a legislative committee for the region. We have a couple of prospects, but we have not solidified anyone to chair the legislative committee. However, we are hopeful that by the next time we meet, we will have a legislative committee for Region 7. And this is inspired by a lot of the other regions who have been submitting legislative proposals. We think that in Region 7, we definitely have some ideals and issues that should be met and should be heard. So we are diligently working on establishing a committee. Our next meeting will be on July 27th. And as everyone has stated, we're not exactly sure if we'll be in person or not. As of right now, we are scheduling for a WebEx though. And that's the report from Region 7. Thank you.
Thank you, Bartholomew. Ginger Nassari with the Adult Committee.
Hi, can you hear me okay?
Yes.
Okay, thanks. Hey, this is Ginger from the Adult Committee, and we had our meeting on April 14th, and Jeff from NAMI came. It was a phone conference and shared about NAMI, its mission, and all of its outreach, and we really, sorry? And we really appreciated his input. We finalized our needs assessment for submission the very next day, and we focused on housing for both folks with the mental health and substance use disorders, as well as workforce development, and also want to focus on improving community communication with community partners around opportunities for treatment for the substance use disorders. And that's all we had. Thank you.
Thank you, Ginger. Just one reminder, if you are using your phones, please make sure that they are muted, also with the computers. Let's move to Vicki Harris with the Children's Committee.
We had two presentations during the Children's Committee. The first was from Becky Brumley with the chapter of the American Academy of Pediatrics. told us about a program they call FIT, which is the Pediatric Healthcare Improvement Initiative for Tennessee. And y'all, seriously, if you don't know what they're doing with this program and how it's impacting the mental health piece of the work with pediatricians, this is really important work. And it was so good to hear about the trainings that they're providing to their pediatricians and those who are part of the pediatric practices, inclusive of early periodic screening, diagnosis and treatment, behavioral health and pediatrics, coding and programming for screening tools and mental health. So lots of work going into what's happening on the pediatric side of mental health. And it was a great presentation. And then we heard from Melissa Birdwell from Frontier about their telehealth services for adolescent intensive outpatient programs and what they're doing virtually with families, especially during the pandemic, to continue their services and how they were able to engage families through telehealth in what is a very intensive program, inclusive of family therapy. So it was awesome to hear about that. We also talked with Carrie Virgo just a little bit about what's happening around system of care across Tennessee and some of the new sites and initiatives. And she agreed to come back next time and talk to us more about those system of care across Tennessee programs, but also about the Children's Behavioral Health Safety Net. So one of the things that we agreed in our meeting, that as providers, it's extremely important that we are putting the word out to our networks about the opportunity for people to engage with the Behavioral Health Safety Net for children, and how important it is for us to be putting the word out about services for families, because they don't know what they don't know. And I will end with this comment. I love this group. I have so enjoyed being part of this group, because after 10 years of being with Tennessee Voices for Children, every time we meet and hear presentations, I learn more and more and more about what people are doing in children's mental health in our state. And there's so much collaboration opportunities out there. So I encourage you to take advantage and come meet with us and learn what you can learn about children's mental health. Thank you.
Thank you, Vicki. Moving on to the Consumer Advisory Board, Dina.
Thank you, Kim. Good morning, everyone. Good afternoon if you are in my time zone. The Consumer Advisory Board meets the first Friday of each month, and we'd like to report that we heard presentations from the following resource speakers. In March, we had Gina Turley, who gave us a Recovery Within Reach website update. In April, we too had a presentation from Project Rural Recovery, Darren and Shelley and Debbie, and I am looking forward to hearing from them today as well. And in May, we had Christy Spangler from the Department of Housing and Homeless Services. She gave us an overview of everything she manages and the programs there. And in June, we did not meet because we had a training in older adult peer support, supporting older adults remotely. Several of us were involved in that, so we did not meet in June. And we were inspired by recovery stories from the following speakers. In March, we had Randall Burge, a CPRS, who is a regional overdose prevention specialist. In April, we had Brandon Powell, who's a CPRS and a Project Lifeline peer coordinator for Region 6. In May, I told my personal recovery story, and it's always an honor and a privilege to do so, and very empowering. And again, we did not meet in June. We turned in our needs assessment in April, and we continue to set aside some time each month to share wellness tips and just support one another. And we switched from WebEx to Zoom in May. The link can be found on the tn.gov webpage for the Consumer Advisory Board. The CPRS 2021 virtual conference planning is going well. Our theme is Rolling with Resiliency, and we are accepting workshop proposal submissions until June 30th. If you want to submit, you need to just send an email to Marta Hernandez. It's mhernandez@alliance-aids.org. Our keynote is going to be a little bit different this year. The title is Rolling with Resiliency Across the State of Tennessee, with speakers from each grand region sharing their recovery stories. And the conference planning committee meets immediately following our CAB monthly meetings. And if you would like to participate in that, you want to contact Michelle Webster or myself, and we'd be really happy to have you in on that. Finally, we have 4 membership openings, 1 in Region 2 for a person with lived experience in mental illness, 2 in Region 4, and 1 for a person with lived experience in mental illness, and 1 for a person with lived experience in substance use disorder, and 1 opening in Region 5 for a person with lived experience in mental illness. If you're interested in more information about the CAB, please feel free to contact me at any time, Dina Savanos, and you can contact me at csavanos@tamho.org, or you can get in touch with Kathy Haley, Lisa Reagan, or Michelle Webster. And our next meeting is going to be on Friday, July the 9th, from 9 a.m. till 11 Central Time. It's open to the public, so please join us if you can, and thank you so much.
Thank you, Dina. Okay, now I have the executive committee report, which is really not a lot that I have to do because we met, the executive committee along with the legislative committee met on May the 27th, and we reviewed the legislative proposals that to be submitted to the department for the 2022 legislative session. A total of 9 proposals were submitted from Regions 2 and 4, and they were presented and we discussed those. And so at this time, I'm going to go right into Debbie Hillen and let her give her legislative committee report.
Thank you, Kim. We did meet on May the 27th. We were presented with 9 proposals, as Kim said, from 2 and 4. We ended up, after discussion of all 9, actually 2 of those were combined because they both address workforce development. And so we ended up with 8. 4, we ended up recommended going for to move forward as a legislative proposal. And I'll start with those. Region 2, proposal number 4, Tennessee Behavioral Health Services Accessibility and Modernization Act. That's a mouthful. So if y'all bear with me, I'll give you the summary. Since the pandemic, service providers have been allowed by rule to provide billable and by rule to provide grant-funded behavioral health services through virtual methods and by phone. This was initially directed at peer centers, but after some discussion, it was amended to include trainings in any contract funded department. So meaning peer centers, training, and telehealth could continue through any contract department facility programs. This was in reference to the health insurance equity, making sure it didn't matter whether it was a health insurance or if it was funded by the department, it would be a billable service. This was moved to go forward as a legislative proposal. Region 2 and 4 both submitted proposals dealing with workforce. Because there were a lot of similarities, we asked them if they would jointly submit a proposal, and they did. It's called the Tennessee Behavioral Health Workforce Preparedness Act. And in what this says is the legislative proposal that both establishes a statewide behavioral health workforce development work group within the Department Facilitated Planning and Policy Council and authorizes an assessment or study of current and future statewide behavioral health workforce preparedness. Now, it goes on to amend Tennessee Code 33-2 by adding 33-2-204, and it specifically goes in there that this be a part of the planning council, and that this work group should include experts representing all 7 planning councils and should be open to any interested party, any member of the region. After a lot of discussion, it was suggested that we move forward with this as a legislative proposal. The next proposal came from Region 4. It was the Fentanyl Overdose Prevention Act. And this would amend Tennessee Code 3917-425 by adding a new section that creates an exception allowing the possession and use of testing equipment that can help identify unexpected contaminants such as fentanyl in controlled substance with the intention of reducing non-fatal overdoses and overdose deaths. In essence, that there would be some kind of testing. There are some testing strips that you can use to test to see if fentanyl is there. But that also is currently can be looked at as a possession of controlled drug paraphernalia. And so this Fentanyl Overdose Prevention Act would make that where you could, so that a user wouldn't have to take the chance of being charged with drug paraphernalia if really all they was trying to do was to check to make sure there was not fentanyl in what they were using. Again, this was suggested to move forward as a proposal. The next one, Leading by Example to Reduce Stigma Act. This proposes to change the name of the Department of the Tennessee Mental Health and Substance Abuse Services to the Tennessee Department of Mental Health and Substance Use Services, just becoming more with what the language is today, taking abuse out and substituting the word use. And there was discussion that's only about 5 states left that have not done this. So this was recommended to move forward as a proposal. Then we had for proposals for future consideration, legit script monopoly inquiry and investigation. To initiate a legislative investigation to identify potential monopolist issues affecting behavioral health treatment facilities and programs in Tennessee, which may lead to imposing needed mandates. What happened here in this discussion was legit script who may be negatively influencing the market. They thought there may be others. There was discussion about other states and attorney generals are looking into this. It was decided to just refer this to Commissioner Williams for awareness and to see what our Tennessee Attorney General may know of this and any implications. So we were asking for information back on what those implications may be. The next proposal was the annual behavioral needs assessment enhancement. Currently, as y'all well know, we submit 2 mental health and 2 substance abuse. And this was to amend the existing statute requiring the 7 regional planning councils to submit annually 2 substance abuse, 2 mental health, but to increase that for a total of 6 and to prioritize those per region. Oftentimes, as many of you know, in participating in the needs assessments, there's a lot more needs that we identify in our region, but being restricted to 2 sometimes makes it difficulty picking and choosing. So the ask was to increase this to a total of 6, still having specifically 2 for mental health and 2 for substance abuse adult children. Again, refer to Commissioner Williams for policy consideration. The next proposal was Overdose Response Act. To establish an overdose facility review team for case analysis associated with fatal overdoses. The creation of this review team would support enhanced community response, prevention, intervention, and post-intervention practices. Tennessee has invested a lot of resources into addiction and substance abuse and overdose. However, we continue to struggle. And part of why this is the committee felt like we did not have access to all the information that was needed, that there could be additional studies done to look at the overdose trends or the fatalities and the near fatalities. We did talk about the fact that here in Nashville Metro, the Department of Health, not the department, Metro Health, actually has a group that looks at that. And we thought along that line, it would be helpful if we had that at the state level. It was decided not to move forward as a legislative proposal, however, but to present to Commissioner Williams for consideration and bring awareness to this issue. And the last one was the Tennessee Jail Substance Use Disorder Treatment Study Project to look at establishing at 3 urban or rural jails, 1 in each Grand Division, clinically appropriate substance use treatment for inmates willing to participate in a 90 to 180-day program, possibly under a memorandum of understanding between the Department of Mental Health and Substance Abuse and the Department of Corrections and the jails. After some discussion on this, Region 2 rescinded this proposal for the originator of this request to have additional time to do some more research. This was submitted to the department, and this would be our legislative report. Kim.
Thank you so much, Debbie. All right, our last committee
Kim?
report would be the,
Kim?
yes,
Could I please ask Debbie a quick question?
absolutely.
Debbie, that was a really great report. I do have a question. You said that all but 5 states had changed their name to substance use. I don't know if I saw that in what was submitted to me. So has it been that all but 5 states have changed their title to substance use? I'd like if you could just email me what you know on that. And then the other thing, that we've been sort of grappling with is you've got the SAMHSA oversight where we get our funding, and they use the word substance abuse, and so we're just grappling with, does it really create stigma? Is it worth changing the name when our funder from the federal level still has that in their name, and other entities in our state have abuse in their name? So really, if you could get to me the information you said about all but 5 states, because I don't know if I knew that. Maybe I just didn't, I read over it.
Yes, ma'am.
Yeah, I appreciate that.
Sorry. May I also ask a question of Debbie, Kim?
Yes.
Okay. After hearing this morning a little bit more detail from the department about their intentions with Matt Yancey and Mary Shelton working on this workforce group, I'm curious now, and I was part of those discussions about the legislative proposal, but didn't have quite the same amount of information that I've heard today. Do we want to move forward with the legislative proposal regarding the work group for behavioral health workforce development, or do we want to wait and let the department do the work that they're intending to do and utilize that information then before we move that forward?
To my understanding, as chair of this, it is my job to move forward with what the committee voted to move forward with. It now goes to Commissioner, and it is up to Commissioner and her staff to determine which ones may actually move forward.
Got it. Thank you.
All right. Thank you, Debbie. Thank you, Ricky. All right, let's move on to the last, that's Planning and Budget Committee. And Kirby, did you say Ben had to hop off the call? Do you have his report?
Yeah, I have his report. I'll give it.
All right, thank you.
You're welcome. Hi, all. This is Kirby. I'm giving the report for the Statewide Planning and Budget Committee on behalf of Ben Harrington, who's the chair. The Statewide Planning and Budget Committee met virtually on May 20th. There were 11 participants on the call. Committee members reviewed a draft of the 2021 Needs Assessment Summary, a draft of the 2021 Multiple Needs by Region document, and the finalized FY21 three-year plan February report. During the meeting, committee members discussed the purpose of the committee, needs identified this year that stood out among others. Workforce development was mentioned by several regional councils and one statewide committee, and how last year's identified needs have been incorporated into the current three-year plan. The committee members decided they would like to meet more regularly. At this time, they meet 2 times a year, but they would like to meet quarterly if possible. They decided they would leave it up to the chair. If he felt to call a meeting, he would reach out to the committee members and go from there. So the next meeting has not yet been scheduled, but once it is, it will be posted at the department website. And that's what I have.
Thank you, Kirby. All right, at this time in the agenda, we want to move to the workforce discussion. And I want to thank everyone for your participation through our Policy and Planning Council. What I want to do is go over how we want to handle this workforce discussion. As Commissioner Williams said, it is very vital to the department, but also across the state, to look at collecting the actionable items and thinking about where we are in the state right now with the work that our department has done under the leadership of Commissioner Williams, as well as the support of Governor Lee and the Tennessee General Assembly. We're in a great position right now with the funding and the appropriations of the different funds. But as Commissioner said, right now what we're struggling with is having the workforce to step up and do those, the great innovative and evidence-based programs that the department's able to fund. And so that's why the department has, created and working together with Department of Division of TCARE to add this workforce group committee. And so we want to take time today because we know that this group here with the Statewide Policy and Planning Council has many people who are very invested in the outcome of what this committee will be able to accomplish. And so what we want to do today is make sure we have an opportunity to hear from you guys so that we can, in that committee, be able to give that voice to that committee as those actionable items are being produced. And so the way we'd like to do this today is start with each region and go through and see if you have things that you would like to suggest for this committee to be able to report out, as well as any concerns that you have. And so for time's sake, I'm going to go through each one of the regional chairs and ask you if you've got anything that you want to add. Please keep between 30 seconds and a minute, because we want to be able to get to other individuals as well. And so those individuals that be thinking if you've got anything that you want to report out. And the way we want to do this is after we go through the regional chairs is to ask that you raise your hand, and that feature is in the WebEx, and it's down at the bottom right before where you look at where you exit. On the left side of that, you've got the 3 little dots. You can click on there and go to raise your hand. And Kirby and Albert, I'm going to ask, as those hands are being raised, that you guys will kind of monitor that because of my technical difficulties I'm having with my upgraded computer. If you guys will look at that, and when we get through, we'll go back to those hands that are raised. But then we want to, this is being recorded, as well as Albert, myself, Kirby, all of us are, taking notes of the suggestions that you guys have. So with that said, I would like to go to Kim in Region 1. Do you have anything on the workforce development that you would like to point out or give us?
Well, I do appreciate the time, and certainly, Commissioner Williams, we deeply appreciate the pulling together this work group. I think it's vitally needed. We're at a critical state in our critical place in our state for workforce development. In our area, we have been focusing on colleges and building an internship model that would bring in interns that we would be able to draw from for a employment pool, and it's been very successful. But that's an area we are very concerned about. Are we focusing on students entering the field of behavioral health? Are they staying in the state and in the area once they graduate? Or what are we seeing as far as the flow of people when they finish their internship, and how's that working? And are we going to be focusing pretty heavily on developing a new pool of employment opportunities for behavioral health through our internships and our college model programs?
Tim, thank you so much for your words on that. As we stated earlier, we're going to have representatives from each of the colleges and universities representing the areas and focus of students that would come into our workforce. Couldn't agree with you more. And we're hoping to have data from them to look at a trend analysis. How many people actually are graduating each year over the last 4 years? What we've learned to date is it appears that University of Tennessee Knoxville School of Social Work graduates 41% of those that come into our state. So I'm very hopeful that I'll get that information from them as well. Thank you for what you said.
Yes, thank you, Tim. And now let's move to Mary Nell in Region 2. Do you have anything for this group?
There we go. It's been 16 months and I still don't know how to unmute. The two things that we experience here in community mental health, I think, is when someone achieves licensure. And that's always frustrated me because the mentoring, the training, the supervision, the time, the investment, all of those things have been done. And then folks go to private. And I can understand why. The demand and the intensity of diagnoses that community mental health clinics are faced with. It's very challenging. We need, the more people we would have, the better off that would be. But so that's one issue. The other issue is that the state, I believe, has a very narrow scope of mental health professionals. I'm a registered art therapist. When I moved to the state 20 years ago from the state of Kentucky, where art therapy folks were recognized at the same level of licensure as social work, there was not that option for me in my practice here. Fortunately, I was able to get a doctorate. But I think those are two issues that I would like us to look at.
Great. Thank you, Mary Nell. Moving on to Region 3, Gail.
Gail had to hop off, but I'm Nicole Bates and I'm representing Region 3. And as part of our needs assessment, with the conversation surrounding the workforce need, one of the things that our region identified is the need for a very culturally diverse group of practitioners as well. And that's notable within our area, that it seems to be not only all of those same issues that have just been mentioned, but just having that cultural diverse workforce that can address those ever rising issues within our region.
All right, great. Thank you, Gail. I mean, not Gail. You're feeling it.
It's okay.
Let's move to Region 4, Robin.
Yes, thank you. So things I think that we need to look at when we're looking at workforce. I really do appreciate the last comment on diversity. I think that's very important. And we've heard feedback just on our helpline, around that issue. But I think the thing that we have to understand when we're saying professional is that we need to acknowledge that in our workforce, and my first thought goes to the regional institutes, is that professional, the people that we need in our workforce, our technicians, the mental health techs, the nurses, the people that are bedside and on the floors. We really need those people, and that's where we are often lacking when we are getting delays, from emergency rooms when we're trying to get people into beds. So if the beds are truly there, then, let's staff the beds, and you need to do that with your techs and your nurses. The other thing is regionally incentivizing and understanding that, a Region 4 and Memphis is going to be different than a rural regional MHI. So I think we need to look at that. I look at what we are dealing with nationally as a shortage. I look at this the same way we looked at the nurses shortage in the 80s and 90s, and what we did as a country, as schools, what we did overall. We need to incentivize this. It's not going to be without cost, but I think, we really need to look at that, and not just the, the what we consider the professionals, because there are, professionals in other ways. The other thing I'm going to throw out there, which has not been mentioned, just a little pet peeve of mine, is mental health occupational therapy. Somebody just mentioned how we're the professionals we don't recognize in this state. Other states recognize that as a mental health profession. These are people who are excellent recovery specialists. It's something we've been working with through Belmont University here in Davidson County. And I just want to throw that one in there. Thank you.
Thank you, Robin. Debbie in Region 5.
I sat here and I thought, okay, what can I ask that's not going to cost the commissioner money? Well, guess what, Commissioner? I can't come up with it.
Right.
We're unable as
Hey,
an
Debbie.
employee. I
So
tried.
fun.
In today's economy and workforce, we are unable to pay the going rate, if you will. We can't compete against the private facilities, not with what we're being reimbursed for. We're competing with McDonald's in many cases to fund positions like night tech, security, intake specialists, those type of individuals. I just recently lost a very valuable CPRS person because they more than doubled her hourly wage to go to a for-profit. The other part that I want to say is we deal with it with a lot of our clinicians. And while we are hiring more and more clinicians with master levels, what I can tell you is, one, they're expensive. Two, they come to us out of graduate school with a lack of experience that requires a lot of training, and that's okay. We can do that training. But then immediately they go to somewhere else, or it ends up not working. So from the school point of view, institutions could they possibly talk with some of us who run agencies and tell them what a counselor really needs to look like? Not just on paper that you did X, Y, and Z, or you had a small internship. That would be a tremendous help.
Debbie, thanks.
Thank you, Deb.
Thanks for your input on that. That's something for sure that I do believe the work group's going to be looking at. You know, the session that was held in the committee where we in TennCare discussed issues related to pay. You know, we've been looking at the difference in pay with DCS workers, difference in pay with other workers. We're going to do all we can to see
I know you will.
how we can address that jointly. And also regarding the culturally and linguistically appropriate services, you know, that is something that we have been supporting for years, ever since I got here. It's in our contracts. It's what we talk to our providers about. We train about it. I mean, I think it's so important for individuals that may be new to our council. If you want to know what we do with that, talk to any provider. They'll talk to you about multiple trainings that have been done, as well as they'll talk to you about their contracts, because that's where we give our money. And their contracts related to making sure our service delivery system is culturally and linguistically appropriate. What I'm excited about that I've already spoken to is we are expanding that work and going to be bringing on a coordinator who will be even more focused than what we've been to date. But please know, for those that are speaking about that, that is something that we attempt to do every day, all day, for any demographic that there is. So anyway, just wanted to speak to that as well. Thank you, Debbie.
All right, thank you. Richard in Region 6. We still have Richard with us. Okay. We'll move to Region 7, Bartholomew.
Hey, everyone. Yeah, so everyone said everything. We need all of that. But I think, and forgive me, I don't know who has said it, but Region 7 is a little bit different. We have a large African-American population. And traditionally, I think we know that the African-American population, they have been in a position where they haven't always been accepting of mental health and the ideal of mental health. And now there's a growth in mental health and substance abuse where Black people are actually taking the time to start to appreciate it. So I think the biggest thing is to have professionals that look like us, that look Black, that can share their stories, and an increase in Black CPRSs in the city. In the alcohol and drug field, making sure we have Black practitioners that represent it. There's also a growing Hispanic population that is in Region 7. So to start reaching out to those individuals in the Hispanic population so that we can start addressing those issues. The Hispanic population is having the exact same thing that Blacks had several years ago, where they were fearful to address mental health. So they turned to the church, and the church a lot of times kind of neglected them. You pray it away. I think the Hispanic population needs those mental health and substance abuse professionals, and I think it's time to kind of start reaching out to them. And I would like to see, moving forward in the future, maybe a minority mental health in the state of Tennessee that strictly focuses on minority mental health with African Americans, the Hispanic population, where there's not a department separate, but an ideal that to actually help lead the country and in the minority populations. So professionals in those realms, I think will be a huge aspect when it comes to the workforce.
All right, thank you very much for that input.
Richard,
Let's see. Go ahead.
I just want to say something to what he said. You know, I started out in Memphis, Tennessee at Midtown Mental Health Center doing my work, and love that community, love Shelby County, love the providers that are there and connected, and absolutely agree with what you're saying. And your points are well taken. I think there's something that we might look a little bit more at. So thank you for your words about that. The other thing, I think I'm getting some comments to what I said related to the cultural and linguistically services that we have. Absolutely, we know that it's about the professional and more than the diversity of the professional and bilingual needs. Nicole, please know I know that. We really are looking at cultural and linguistic diversity across the board. And let's see, Daniel, you made a comment about the need for practitioners of color and that focus on minority health as a direct aspect. Absolutely. I think Matt, if Matt Yancey's still on here, as we're talking through that with the workforce development group, one thing that would be good is to see what is the demographic of those that are actually graduating as it relates to diversity in that group. So Daniel, thanks for bringing that up. That's something that I'd like to see if we could get data on that. Very much appreciate that. And I said, I'm sorry, Bartholomew, did I call you? Are you Richard?
Ma'am, I'm Bartholomew.
Sorry.
That's okay.
Calling you Richard, dear. I apologize.
I think we're both bald, but that's about it.
All right, thank you. I'm sorry, Bartholomew.
That's
I didn't
okay.
get that right. All right, thank you.
No problem.
May I ask a question? So,
Yes.
a lot of the workforce, in my experience, my circle, tend to have become rather afraid of the hiring process, especially people from diverse backgrounds. Is there any wisdom that you could give me to kind of convince them to come see you, become peer supports or other positions? Is there a way that words that you can give me to ensure them that they will be safe? One of the things that I'm constantly building with my friend group is it is safe to come to, but it is safe to come to these programs. They aren't going to hurt you when you're seeking help. I want to hear what you would say when people are afraid.
Hey, Rebecca, thank you for asking that. And I'm going to say a couple of things to you. Number one, we need more people like you. I see Nicole shaking her head, more people like Nicole that are out there telling their own story of recovery and offering that sense of hope and help, because nothing's more powerful than a person who's been there, done that, which is why we've invested so much in peer type services. So that's the first thing. Secondly, our department is really investing, as I told you before, about our youth directed activities. So we are actually investing in new services. Lisa talked about that earlier, the youth peer support. That's going to be really important. But also this person that we're bringing on board for the internship, I'm very hopeful that she will help us, those of us that are not part of the youth group. One of the things that I tagged a line, I said, this will be a once in a youth time experience. Because we're not there. And we need somebody to help us understand what's the best way to get individuals that are young to say, hey, I'm willing to raise my hand. I'm willing to come in and get help. So I hope if Matthew's still on here, he's got y'all's names down, because it would be really nice potentially to bring y'all up and talk with this intern that we're bringing on to sort of focus on that. But off the top of my head, those are the items that I would say. I'll open it up for any of the other team members or provider members that might have better options if they'd like to say. I know I just saw Dr. Chappell's on here, and she oversees programs. Dr. Chappell, is there anything you would add with because you're overseeing youth programs as well?
No, ma'am, Commissioner, I think you just do a splendid job in explaining everything. So thank you.
Well, some days are better than others.
Hey, Commissioner, this is Matt Yancey. If I could just add a couple quick things. Rebecca, I appreciate you speaking up and for the interest in the work. I will say over the past 5-6 years, our department has really prioritized our young adult focus. As you may know, we have first episode psychosis programs across the state funded through the Block Grant, which really looks to serve young adults ages 15 to 25 or so. We're looking to expand those programs even further. We've had several SAMHSA discretionary grants that have funded our healthy transitions work. And there's a big component of that of actually training providers across the state on how to be more culturally responsive to youth and young adults. I think we recognize that for a long time, there's been kind of two systems. There's a kid system and an adult system. And in many ways, the young adult population doesn't know which way to turn. So I just wanted to add those things. You may be involved too with the Young Adult Leadership Council that we convened to help drive the development of the CPRS Young Adult Curriculum. And if you were a part of that, we really appreciate it. And we took y'all's voice in developing that out. So there's been a lot of work, a lot of momentum. We're not quite where we need to be just yet, but we need folks like you speaking up. So thank you for your comments today.
Thank you. And if possible, I didn't want to really interrupt Bartholomew's words because he was talking about diversity. So do you have words to that too?
I'm sorry, say it one more time, Ms. Lewis.
You were speaking about the importance of diversity in the mental health profession. And so one of the things I was asking this for is also how do I share that there's diversity safety too.
Right. So once again, I am a full blown on board supporter of CPRS. CPRSs they're pretty much the segue or the bridge between where a person is and where a person can be. They oftentimes, I'm not a CPRS, I am one of the sites so where you can get your credentials, but they're oftentimes the voice of calm when someone is making that journey and having that journey. It changes a little bit when you are of color. A lot of times having a CPRS that looks like you helps out, and they still serve the exact same purpose. Now what's twofold. Now they have the idea of actually living with a mental health condition or having a substance abuse issue, and they look like you. And when you have that on your journey, it makes it a little bit easier to start trusting people along the way. You don't just jump from point A to point B, and you probably know this. I know I'm speaking to the choir, but when it comes to that sense of making that first step, it's always easier when the person looks like you. And then after a while, once you get past that point, then you start having this sense of, and for lack of a better term, sense of spirit. When the person's spirit is welcoming, then it doesn't matter what they look like. Then you feel them. You feel that they really genuinely care about you. And when they genuinely care about you, you start moving a bit closer to the point of wellness and making the journey. So to answer your question, I think it really takes a lot of different facets to make someone comfortable. However, I think the first part, and I am an advocate big time, is having a CPRS that looks like the person or has that sense of spirit that they want to get well and want to get better, and kind of moving them from point A to point B. I hope that answers your question. I know I kind of went a little bit everywhere, but it's just different when you look like me, because I hear things differently. And ironically enough, we live in different worlds. And it's a blessing when you can combine those worlds. And sometimes the CPRS helps combine that world where you are and where you want to be.
Thank you, Bartholomew. Thank you so much, Rebecca, for reaching out, and for Commissioner and Matt's responses. What I'd like to do in the next minute is give Ginger and Ricky and Dina just a little bit of time to report out on that. And actually, Ricky, I think you're going to be part of that committee. So Ginger, we've got to, if you would, go ahead and let us know if you've got any suggestions or comments related to the Workforce Development Group.
Thank you. I appreciate the opportunity to for this discussion. It's so important, and I agree with what everyone else is commenting on. It's not just the professional staff; it's the direct support staff that's a critical need throughout our region. And I do want to kind of throw out some little bit of hope and optimism. I think telehealth has been remarkable in being able to help us get care to our more rural areas. So we can use telehealth in a more creative manner. But I do think that the rural areas are still very, very underserved, and we might look at some creativity in recruitment. Can we change the loan repayment process? I know some agencies are participating in HRSA loans, but are there other ways to have loan repayment a little more accessible and creative? And or are there other creative things like you hear on the news about some communities helping people with a down payment for a home? So would that be a way to get people invested in a new community and help them be more part of that community and willing to stay in the community once they get licensed? That's it. Thanks.
Thanks a lot, Ginger. Dina, do you have anything?
I just appreciate what everyone else has shared, and I don't really have anything more to share at this time, but I'm enjoying this conversation very much. Thank you.
Thank you, Dina. Yes, this has been some great conversations, and Kirby is letting me know that there's not any hands raised right now. So what I'd like to ask each of you to do, because this is so important and so vital to our state and to the work group, and so if you would, if you've got any other suggestions or concerns, would you please email Kirby? Again, that's kirby.fi@tn.gov. And so now, and just want to reassure you all that, Commissioner Williams was definitely committing to every one of you that she will circle back around to keep everybody updated on what that group is, the work group is doing. And so thank you again for all of your input. And so now let's move on to
Kim, sorry,
yes.
It's Kirby. One last thing. If you can get those suggestions to me by close of business this Friday, June 11th, that would be great.
And
thank you. I did get to say that.
And Kim, one other thing I just thought about that I should have spoken to earlier. One of the things as a department who gets federal and state funds, we have to monitor and oversee Title VI requirements related to diversity, not only in workforce, but also in those that we serve. And something I think would be really important for y'all to know, Gwen is the person that leads that effort for our state. And I've been at the state now and been involved in Title VI for 20 years, and we have never been found out of compliance related to our oversight and our diversity in the workforce and amongst the provider. It even includes us giving information on the provider communities. So I think, again, there's more we can do, but it would also be important to know, and I wish I'd spoken to that earlier, that we have to actually report and be overseen on this. And I just got the letter about a month ago from the committee saying, again, thank you for your report that you've submitted. You have met all requirements. So I hope people are aware of that. Again, that's something that's important to us.
Thank you, Commissioner Williams. And I know, as all of us as providers, we have our audits and things. I know it definitely is a commitment that you guys have, because you always focus on those issues as it relates to Title VI. And so thank you again for your commitment on that.
Thanks. And I will say this to Bartholomew's responses. The other thing, when they look at that, they look both individually at those that we fund, but also at the state as a whole. And like when you've got communities like I came from in Shelby County, I do think that there's more we can do to have representation related to more African American individuals that are in our service delivery, actually delivering services, both certified peers as well as professionals themselves. And for those of you that are part of the diverse community, thanks for your witness and your leadership, because that's what we need. Thank you, Ken.
Thank you. Let's move on to Dr. Chappell, if you would. I think we're ready to have your presentation, and thank you so much for being here today, Dr. Chappell, to give us this very important information.
Okay, I am just so happy to be here, and I guess I'm trying to see. So, Kirby, do I share my own?
It's up to you. If it's easier for you to share, go ahead. If you want me to do it, I can.
No, ma'am, I will just be happy to let you share. Thank you.
Okay, just let me know when you want me to switch slides.
Yes, ma'am. Thank you. Appreciate it so much. Okay, and I guess I want to start off. I'm going to try to be as brief as I possibly can. Some of you all who know me know that sometimes I can talk. So I hope I don't do that, but I get very passionate about projects, that make a difference in the lives of people. And so sometimes it touches me, so I just keep going, but I'm going to try to be good. I would like to start out by saying that having grants has really helped feed the clinician in me, and I realize that, and because it puts me closer to where my real heart is, and that is being able to make a difference in people's lives. And so this afternoon, I just want to briefly share some final preliminary data for the TechBot Tennessee grant, which is one of the grants that I have. Next slide, please. This particular grant, next slide. Thank you. This particular, This particular grant actually was funded through what's called Matt Fedora. And this funding source gave us, through a competitive process, $6 million in awards over a 3-year period. And we were just so excited to be able to receive this grant. And when we started, because the focus here was more to close the gap in access and delivery of the evidence-based MAT services. But when we started, there really wasn't a lot related to MAT going on in our particular state. And so we were glad that we could be one of those resources to add to the availability of evidence-based MAT services for people with opiate use disorders. This particular slide shows you that in year one, when we started, we only had 4 providers, but we couldn't have implemented this without these fantastic providers. So our base providers were Buffalo Valley, CAP, Frontier, and then we really started with Solutions of Savannah, but the name changed in year 3 to BHG Savannah. But this was just an awesome group of providers. Next slide, please. Then in year 2, what we did was we changed the scope of services, because one of the things that we realized is that, there are just a lot of people out there who were in need of MAT services for their opioid use disorder. And this was more of an outpatient way for people to be able to do that, so that people could continue to work or continue to be with their families. And so we asked for an expansion of the scope of services because we were still in our state having, lots of overdose deaths related to opioids. And so we added Cedar Recovery, BHG Columbia, and BHG Paris. And then finally, by year 3, oh boy, we really got a lot of support from the provider community. So we added 12 new, next slide, I'm sorry. We added 12 new treatment providers. And so you can see how we expanded over the 3 years of this particular grant. And we were just so excited to be able to add BHD Dyersburg, Jackson, Memphis North, Memphis Midtown, Nashville, Knoxville Bernard, Knoxville Citico, and also at Cumberland Heights, Meridian Behavioral Health, Catalyst Health, Park West, Knoxville Outpatient, and then Volunteer Treatment Center. And these 19 providers actually had locations where we served 14 different counties of the state. Next slide, please. Also connected with this grant was an evaluation component, because as with everything, we wanted to make sure that, that we're making a difference. And the evaluation component also helped us look at what we were doing as we were moving forward. Did we need to make any tweaks here and there? And that was one of the things that we saw when we realized that we needed to increase our scope, because there were so many people who just did not have the resources, were part of that underserved community, no insurance, or their insurance options were limited, but they had a real need and desire for treatment, and we were able to be one of those resources for them. So Centerstone's Research Institute served as our evaluation provider across all 3 years of our grant project. Next slide. This next slide is a map to show you what those 14 counties are, the service counties. And so we ended up with, by year 3, we were serving 5 counties in West Tennessee, 5 in Middle, and 4 in East Tennessee. And when we started out, we actually targeted all 3 of the grand divisions of the state. And you can tell that we hit that particular target. Next slide, please. Even though we were only serving 14 counties, our patients came from 80 of those counties in Tennessee, which was, really, really fantastic. And as you providers know, I mean, you all meet patients where they are. And so we were just so appreciative that we would be able to have that kind of outreach, so that we were actually providing services to, persons in many, many counties across East, Middle, and West Tennessee. Next slide, please. Our original grant application said that we would serve at least 660 patients. But you see that 597 number. Well, we ended up having to kind of drop down, because our first year, which was the startup year, you always kind of behind the timeline. So you don't get to have all of your little ducks in the row at a time. So we actually asked SAMHSA, could we reduce our numbers served? Because we wanted to make sure that our department and our state was going to be well represented, that we were going to meet the projected numbers that we served. And so SAMHSA agreed to let us take that reduction in numbers. So we were still destined to try to serve 597 persons. Well, next slide, please. Never in our wildest dreams did we think that we would serve almost 1,500 patients. I mean, this was just fantastic. And it's all due to our providers. this achievement, their dedication, their diligence, their excellence, and we can't thank them enough. And I was listening, as people were talking about COVID and, some of the other grants I have, COVID has done some things, but I tell you, our providers, and just like you all, I'm sure, just worked exceptionally hard so that COVID did not stop them for providing the needed services to the persons who were truly in need of assistance with their treatment and couldn't afford to do it on their own. So we are much appreciative to them. And when we looked at the like intake rate, we were off the charts for this one. Next slide, please. So just who did we serve? Next slide. Our patients were 83% white. We had slightly more than 70% that fell between the ages of 25 and 44, and nearly 60% were male. Next slide, please. We targeted veterans and women of childbearing age, and we were successful in engaging patients from both of those groups. Next slide, please. We were also fortunate in having at least 2% of our patients identify as Hispanic or Latino, and more than half of our patients reported having co-occurring disorders. Next slide, please. When we look at the very beginning of enrollment at intake, you will note that heroin and, of course, THC were the most commonly reported substances of use at that particular time. And, of course, many patients reported using multiple substances, and some of them actually reported using all of the substances that you see there in that list. Next slide, please. Our patients ran the gamut educationally, with 1/4 having some higher education and about 1/4 that had not completed high school. Next slide, please. And so what did we accomplish? Next slide. Well, we were pleased that our patients reported reductions in substances from intake 6 months. I mean, this I could just jump up and down and dance, even though I can't physically really do that. But it is just, fantastic to know that these numbers, these results show that, we did make a difference in people's lives. And most of these reductions you can tell as by the asterisk there, because intake, of course, is the red, I'm sorry, and at 6 months is the blue. But that asterisk shows that those findings, so those reductions are significant. And we are just really, really excited about those particular results. Next slide, please. When we looked at the national outcomes that SAMHSA requires us to look at too, all of those were positive. There were positive changes from intake until 6 months, and we actually had significant changes when you took a look at those health, behavioral, social consequences. Patients said that they did not have any of those kind of consequences, about 85%. That was a significant jump from intake. And the same thing is true in abstinence, which is, not using. So we are just, really, really excited about that particular outcome. Our next slide, please. What we wanted to do was just kind of show you how we looked in comparison to, because our funding source, for example, is different from, say, STR or SOAR or whatever. So, we wanted to see, well, how do we fare, in comparison to others that got MAP PADOA funding? And you can see that our outcomes, our national outcomes, the findings are very, very similar to what our fellow cohorts are also seeing with their particular patients. So we were glad, you know, that we were very much aligned with other MAP Fedora programs. Next slide, please. Another piece, and you mentioned it as it related to COVID today, you know, which is a lot of the, you know, the mental health outcomes, and there was, you know, a lot of anxiety, lots of depression, and so forth. And you can see that our patients demonstrated improvement in mental health outcomes by 6 months, with significant reductions in depression, in anxiety, and in those ADHD symptoms like the trouble understanding, concentrating, and remembering. Now, we did see, if you look, there's one of the outcomes, the prescriptions for medications for their psychological or emotional problems that we looked at that, and we really weren't necessarily thrilled with the fact that there was a reduction in those prescriptions by 6 months. However, one of the things that our grant was supposed to do is our providers were also supposed to help these individuals find more stable treatment resources. And so what we think may have happened is because, and you'll see on the next slide, that due to improvements in employment and so forth, that persons may have actually been able to get more stable treatment resources as opposed to having to stay on the grant. So that may explain that particular result. Next slide, please. Here, next slide. Okay, so here you see with that first big bullet, the 36% increase in employment from intake to 6 months, with many of our participants being employed full or part-time at the 6 month period. And then we had that 158% decrease in the percent of participants who received inpatient services. So the other thing that we saw was our patients were reporting less utilization of high-cost treatment services like rehab at the 6 month period. And so we thought that that was a very important change and are very proud of that. Next slide, please. We credit our providers for the focus on the whole person. One of the things that we did was we provided through our grants, and SAMHSA approved this for all of our contract providers, and that was to be able to provide some funds for integrated care services. And so we think that the fact that we were able to do that is another one of the reasons that our program is showing some successful outcomes. Some of our providers have provided smoking cessation resources. They've been able to pay for medications for physical and mental health issues, you know, because surely if you don't have the resources to pay for your substance use treatment, then you wouldn't have resources, say, to pay for your blood pressure medication or your medication for, you know, depression or whatever. And so our providers were able to use funds to be able to do that, or to help with vision care, with some dental work. Food, we even had some providers that went so far as to enter into agreements with some of the large grocery chains and provided vouchers to their patients so that they didn't have to worry about whether or not they were going to eat, you know, taking care of a very basic need for our patients. And of course, being able to provide assistance with transportation to and from their treatments. And so all of those were very important. Next slide, please. This grant also, and I think this ties in with your, you know, focus on workforce. One of the things, and a lot of people don't know, that the TechBot Tennessee grant was able to do was to provide training organized by TALIS. And we did this every year of the grant. The first 2 years, and some of you probably remember the MAT training institutes that were held. And so TechBot Tennessee was able to provide those. And last year we would have, of course, had that, but COVID stepped in. But TALIS was, Mary London and TALIS staff were really very creative, very resourceful. And so you all now have the opportunity to have training opportunities for staff, so that that motivational interviewing training, some of the CEs that you will be able to get through the Association for Psychological Therapists, or to be able to have staff participate in Reliance training. So all of that, certainly, if you're improving, you're empowering, you're building the capacity of your staff, which means that you're offering these patients, some of the best services that they could receive. And so we are just really excited that we have been able to provide that particular piece for providers across the state. Success stories, next slide. Many patients, of course, have come a long way, and it is clear from the 2 success stories that we have there. And I'm not going to read those because of time, and I want to make sure that we have ample time for our next presenter. Kirby, you can just go through the next 2 slides if you want to, but you can see, because you had those, where those individuals started and what the grant was able to help people be able to. So we are just so appreciative. And then we have, what the patients had to say about the program. They were very satisfied with their TechBot Tennessee services. Next slide, please. Just, from looking at these particular percentages, you can see that they felt that they received high quality services. They were treated with dignity and respect. And whether when you're talking about getting people to participate in treatment and so forth, dignity and respect is important. Well, it's important all the time, because people just need to know that they count. And so, and especially for this group of individuals, they really need to know that they are respected, that they are highly valued. And so, these TechBot patients felt that way. Our providers helped them feel that way, and they were empowered. And so we are just excited about all these achievements that these grant funds have been able to provide. Next slide, please. When they were asked specifically about which aspect of the program they liked best, some of them said everything. Some said the grant. They helped me with my finances with the grant. But one thing I think that really stood out for me, and you can read through, we just put a few of their comments, but I was really intrigued by the very last one. It's user friendly. And I like this one. It was very interesting because for me, I was thinking this is a very positive way of acknowledging how well the program was implemented. And that's hats off to our providers. We say thank you. Only you could have set the program up for people to feel like it's user friendly for me to go through the grant services that are being offered through your particular agency. So these are the kinds of comments really that touch my heart, and just make me feel all warm and fuzzy inside. So we are, these are some of our preliminary outcomes. Next slide, please. So that's TechBot Tennessee. In a nutshell, we're just excited about what we've been able to do, along with so that we have provided some benefit to persons across the state with opiate use disorder. We've added to the numbers who are able to receive evidence. Because a lot of times people don't get evidence-based treatment. And so we have been a part of that, and that has just been so exciting, so rewarding, so fulfilling. So are there any questions? Well, if there aren't, then next slide, please. I just say thank you, thank you, thank you to everybody. And we are indeed grateful to SAMHSA and the department because through the funding, we have been able to offer these services and supports to persons with OUD. So you all have a very, very blessed day, and I'll be here for the rest of the meeting. Bye.
Thank you so much, Dr. Chappell. Great to see such positive outcomes and the reach that is being made across the state with those individuals getting those such needed services. So thank you so much. Now, we would like to have Darren Lehman and Debbie Hillen to provide a Project Rural Recovery update.
Hi, Kim. This is Darren. I know we're significantly over time, right?
Right.
Okay.
We've got time.
Okay. So I'll fly through it very quickly.
All right, thank you so much.
Darren, do you want to share it, or do you want me to share it?
If you could share it, that would be great. Thank you. I'll turn on my camera here. All right. Well, hello, everyone. My name is Darren Lehman, and I am the project director for Project Rural Recovery. And I just wanted to thank everyone for spending a few minutes with us to give you an update on this exciting project. Next slide. All right, so quickly what it is: 2 mobile health units providing integrated behavioral health, substance abuse, and primary care services in 10 counties, operated by our 2 fantastic partners, Buffalo Valley and the McNabb Center. It's a 5-year project, and we are in year 2, which began on March 31st. Next slide, please. So the goals of the project was to create a model of integration, and also then to serve at least 10 patients per day per mobile health unit. Next slide. This is the scope of services that we are currently providing, and we'll continue to change that and evaluate it as we see more and more patients and determine what needs are most needed in those communities. Debbie, anything you'd like to say about the scope?
Yeah, I will tell you that this was definitely a out of the box, trying to figure out how to integrate primary care and behavioral health. And while you see the primary mental health and substance abuse services, what I want to tell you is on some of the primary care, because my counties, you'll see them here in a few minutes, are in southern rural Tennessee. But we do CBCs, we do metabolic panels, we do A1Cs, EKGs, finger sticks, cholesterol testing, pregnancy urinalysis. We have a breathing machine and a carbon monoxide machine. So there is a lot of physical health services that are being delivered on the bus, as well as the mental health and substance abuse services. And I'll go ahead, if Kirby, if you'll go to the next one. The team that sits on this bus is a nurse practitioner, a behavioral health clinician. We have a CPRS, we have a bus driver, we have a medical assistant, and we have an intake person. So there's technically 5 people every day on this bus. This bus is not the Taj Mahal. It's It's small, it's confined. If you're claustrophobic, it probably ain't gonna work for you. But these 5 have figured out how to make the best use of the space on the bus and to work as a team. Now they've got other people outside the bus, the program director that I've hired, as well as myself, that pops in and off the bus to help when possible.
Okay. Thanks, Debbie. Next slide. These, as Debbie just mentioned, these are the counties that we are located in, and you'll see another slide where we're serving patients from counties surrounding these areas as well. And then Shelley Hall is the director for the McNabb Center project. Next slide. This is the Buffalo Valley Mobile Health Unit, and as Debbie mentioned, it is a pretty tight space. Just going left to right, there's a picture of the outside, a little small waiting area. The next one is the small lab area, and then one of the exam rooms. So each bus has 2 exam rooms, a restroom, and a small waiting area. And then the bottom right corner is the McNabb bus. Next slide. So year 1, we had a very late start. We served patients in December to March. We think this is pretty successful. We saw 326 individuals with 452 visits. I won't go through all of this. We have these slides, but we were very pleased with at least seeing this many patients.
I will say that I forgot the March 1 deadline, but I can tell you from December, I think it was when we first saw our first patients on the bus till June 3rd, we have seen a total of 656 individuals on the bus, and that's just on our bus. I don't know what McNabb has done, but we think that's at least 656 people that did not have primary access to primary care or behavioral health services in those rural southern counties. So we're glad to be a part of it.
It's definitely meeting a need, yes. Next slide. All right, so for year 1, we have 50% of the patients need something related to primary care, 24% for medication management, and 26% behavioral health and substance use services. Quote there from one of our patients. And then also the map, it shows the bus locations in red, and then in blue are all of the counties where patients are residing and coming from. So definitely reaching beyond just the service area that we're located in.
And that's an important part to note, that the buses in those 5 counties, but somebody may hear of it and come from another county over, or somebody's heard about it. And so we don't turn those away. They're welcomed on the bus just like anyone is.
And I should say the bus serves patients of all ages, and it's free. And if they have insurance, we would bill insurance, but otherwise free. Next slide. Just a quick total visits by county. Lewis County definitely has the most patients, and Fridays are so far the most popular day for services connected to the counties there. Next, and the reason we're looking at this is this allows us to continue to really monitor where we have the buses and the days of the week and times of day, so that we need to make changes in the future, we're able to do that. Next page, next slide. Year 2, just quickly, we're going to continue to do community outreach to increase our referrals. Continue looking at the data, as I said, just to look at hours operation, bus locations, working with providers and patients to identify any service enhancements like other mobile services that we could partner with. Exploring telehealth opportunities for specialty services. If patients are unable to travel, they could get on the bus and do a specialty visit from telehealth or via telehealth. Looking for opportunities for sustainability and potential growth. That's one of the key program goals. And then also looking at how we really make sure patients are showing up for their quarterly visits. It's one of the required data elements for us with SAMHSA. Next slide. And here is all of our contact information along with our website. And that is all I have. Thank you for staying on and listening to me go through this.
I think one of the things that's really important is that Lawrence County is actually home for me, so I can speak about rural Tennessee. In that I was a little hesitant about how this was going to be received in some of the rural counties, and I have been surprised, especially in Lawrence County, about how this was going to take off. But they were hesitant at beginning. We've done a whole lot of outreach, knocking on doors. We're not here to take your business. If you're a medical provider, we're here to add value to what you provide and what you do. And it's been received well. And we're very pleased to be a part of this project, as we were with TETBOC.
Yeah, it's been great. And it's been a fun project to be part of. I know we moved through that very quickly. Please feel free to reach out to any of us if you have any questions, suggestions, or other comments. I appreciate it. Thank you.
Darren and Debbie, thank you so much. This is, again, a great presentation, and it's so good to know that across our state we've got individuals that otherwise would not have access to services, that's being done, and being done through these creative ways that the department has been able to do with the appropriation of funds. And so, again, great presentation. So today's meeting has been a very, very informative one and a great meeting. And it's just basically, today's meeting was a representation of what all is going on in our state as it relates to the needs of individuals suffering from behavioral health issues. And so, as Commissioner said, we've got a lot of great things going on in our state, and so a lot of things to talk about and a lot of things to work towards, as far as actions moving in the right direction. And so, again, I want to thank everybody for being a part of this meeting, and for the presenters, the guests, our members, Senator Massey, and Representative Ramsey for being here today. Again, thank you so much. Our next scheduled meeting will be Tuesday, August the 10th from 10 to 1. And as of right now, it will still, the location will be Middle Tennessee Mental Health. However, this will be monitored as we go along as it relates to COVID restrictions and such. And so at this point, I just want to say thank you all so much for allowing me to be the chair of the Statewide Policy and Planning Council for the last 2 years. It has been a great opportunity and great to see the great work that all the providers and advocacy groups and everyone's been involved in. And I'm looking forward to continuing to see the work that's going to be done under the leadership of Albert and Ricky. And as I have said multiple times, this position as chair has been the easiest position that I have ever had. And that's because of the work from the department, from Avis, from Kurt, from Kirby, and from Amy, Zach, all of you guys in the department of planning department have been amazing. And so I appreciate the work and the collaborative effort that has been done over the several years that I've been involved in the statewide. And so thank you all so much. At this point, I would like to see if there, before I ask for a motion to adjourn, Avis, Kurt, or Kirby, is there anything that I have left off that we need to bring up before we adjourn?
Kim, this is Avis. Nothing else comes to mind, but I just wanted to take this opportunity to thank you for serving as our chair for the last 2 years and vice chair 2 years prior to that, and also in your leadership role over the last 12 years being on the council. You served and wore many hats between the regional council as well as the statewide. So I really appreciate you being an awesome chair. We just are so happy that you're going to remain on the council as a member of the statewide council and continue to work with the region 6 council as well, and that you are going to continue your work on this workforce development work group that's just started. So again, thank you and congratulations going forward to Albert as he moves in and transition in his new role as chair. We're excited about having you as well, and Ricky Harris as our vice chair, who both of you will bring a wealth of knowledge and information and expertise and leadership to this council. So thank you all, and great meeting Kim and Albert today.
Good. Thank you. All right. So with that said, is there, do we have a motion to adjourn? If so, if you would place that in the chat box.
Robin just motioned to adjourn in the chat box.
Okay. Do we have a second? Do we have a second out there?
Ricky Harris seconded the motion.
Great. All right. With the motion and then with the second, if there is any, I would say that this meeting is adjourned. And again, thank you all so for being sticking with us throughout. A lot of great work being done each and every day. Y'all have a great afternoon.
Bye. Bye-bye.